Now moving on to other national stories, stakeholders have called for expanded partnership and sustainable funding to deepen gains in women's empowerment, youth leadership, digital safety, and community health, particularly in Nigeria's underserved rural communities. Speaking at the official presentation of the organization's 2022-2025 Midterm Impact Report, the executive director of SieDi-Hub, Chinasa Imo, stressed that meaningful social progress must reach beyond major urban centers to include remote and marginalized areas. Our correspondent tells us more on this story.
Empowering women, nurturing youth leadership, promoting digital safety, and strengthening community health are increasingly interlinked strategies shaping inclusive development in Nigeria. Grassroots initiatives has shown how integrating these pillars can build resilient, equitable communities and drive sustainable progress. One of organizations championing this initiative is SieDi-Hub. At the unveiling of its roadmap to scale its grassroots-led, data-driven interventions across Nigeria's 6 geopolitical zones, the executive director of Chinasa Imo said that there is need to partner in scaling up initiatives such as this as she emphasized that sustainable social impact requires shared responsibility.
Reaching underserved communities and those who are marginalized within the periphery shouldn't be, a secondary agenda. It should be something that we prioritize as a people, as a government, and as a civil society. Because Dr. John is there, he leads in infectious disease prevention and response. He will tell you that most of zoonotic diseases and outbreaks come from these marginal spaces. So you can see why we are interested in making sure that we address things from the base, from the roots, and that is central to us. And we have to orient those things around justice, around development, and around equity. Because if we don't do that, then we are missing something.
The chairperson, governing board, and former director of Health Agency Preparedness of NCDC, Dr. John Oladejo, spoke on the broader policy implications of the report.
From rural women rebuilding their lives after violence to adolescent girls learning to protect themselves online to young policy fellows advocating for health reforms. SieDi-Hub is indeed providing that development that can be inclusive, strategic, and rooted in local leadership. This is not just for a particular community, it's for the community, for the whole country. So if we can start with another states in the east, picking 2 states, then we now move to other geopolitical states, picking one or two states.
On the further priorities, the program manager Paul Lord Opara underscored plans to target vulnerable groups, including internally displaced persons, and address systemic gaps in public health and education.
We've had about 4,535 total program direct reach, plus over 5,000 indirect program reach. Right. So, and in this number I just called now, we've had about 840 youths reached, and we've also had 1,510 women reached. And in terms of policy, we have data for that. We have about 335 policy makers that we have reached in total, and this cuts across the programs that we've had when it comes to policy. Policy briefs and all that.
Rural people, rural children, rural adolescent girls are having issues with, menstrual hygiene. So the government, individuals, philanthropists, all of you are calling on you today to focus on that area and, support SieDi-Hub in what we're doing to achieve, better health conditions for women, children, and the family at large.
As it enters the next phase 2025 to 2027 of its strategic plan, SieDi-Hub plans to expand its digital safety program to at least 30 secondary schools, scale menstrual health interventions, launch a structured youth entrepreneurship initiative, and develop a centralized health data repository to support evidence informed government decision making.